Hello, everyone, and welcome to the first of 4 modules on graphic medicine, the intersection of comics and healthcare. My name is Dr. Rachel Thomas, and I'll be your host and tutor for this series. In the next modules, we're going to talk about how graphic medicine came to be and its uses in public and clinical settings. We'll then go on to focus on specific stories of historically othered bodies in medicine and society, and how artists and comic artists have started important conversations in medicine in order to reduce stigma and improve health outcomes in patients. Our third module will focus on developing narratives in your own comics and some tips and tricks to get you started in your own practice. We'll also talk about bringing graphic medicine into a medical practice and using it to better connect with patients. Our last module will be all things drawing and technical, from developing characters to page layout to the types of materials you can use. This is where you'll bring all the skills and ideas from previous modules to life. The purpose of these modules is to help both patients and healthcare professionals better communicate and interpret experiences that are not easily defined by words. This can also help us build rapport and understanding without biases, and help us to address existing stigma around particular bodies. At the end of these modules, you will hopefully have a better understanding of graphic medicine in general, but will also be able to apply it in daily life, either as a patient experiencing a disease or disability, or even just the daily struggles of life, or as a healthcare professional working through your own experiences, treating and working with patients. Our first module will be on graphic medicine as a whole, where it came from, how it was established, where it's going, and how it can be worked into our personal and professional lives. I'd like to acknowledge that funding for this set of modules comes from the HEAL Healthcare Project via the National Collaborating Center for Indigenous Health. The Hearts-Based Education and Anti-Colonial Learning Project, or HEAL, is funded in part by Indigenous Services Canada. As much of this research and creation was conducted on Quebecois soil, I would like to take the time to recognize that I acknowledge that my work in Tiohtià:ke, or Montreal, takes place on the unceded Indigenous lands of the Kanien'kehá:ka, or Mohawk Nation. Without further ado, I'm Dr. Rachel Thomas, and I'm an assistant professor of comics, graphic novels, and sequential arts at Teesside University in Middlesbrough, United Kingdom. I am Canadian, but moved to the UK to teach and learn about the differences in medical systems and how they approach patient care. I have an interdisciplinary humanities doctorate from Concordia University in Montreal, Canada, with a focus in medical history, medical sociology, gender, and fine arts. Part of my thesis work for my PhD consisted of a full-length graphic novel entitled Shrink: Story of a Fat Girl, which is set to be released by Penn State Press in the fall of 2024. I'll be speaking about my research at the end of this module, as Shrink tackles the obesity epidemic from medical and social perspectives. My current research is focused on polycystic ovarian syndrome, which is a leading cause of infertility in childbearing age women. There is still much that isn't known about this syndrome, including symptomatology, because there are at least 4 phenotypes, meaning multiple presentations of symptoms. My next graphic novel will be addressing this in a format that is accessible and understandable to women going through the diagnostic and treatment process. It is important to note that PCOS does not yet have a cure. So what is graphic medicine? Graphic medicine is a form of medical storytelling that uses comics, graphic novels, and visual art to convey personal experiences, health narratives, and medical information. It combines visual elements with storytelling to communicate medical and health-related topics, making complex or sensitive subjects more accessible and engaging. Illustration has always existed in some capacity when it comes to medicine. In fact, the use of illustration in medicine has a long history, dating back even to ancient civilizations. In ancient Egypt, for example, medical papyri contained detailed illustrations of surgical procedures and anatomical diagrams. This is the Ebers Papyrus, created between 1550 and 1536 BC during the reign of Mepolis I. It's thought to be the oldest and most extensive record of Egyptian medical history, featuring over 840 remedies for illnesses and injuries. Similarly, ancient Greek and Roman medical texts often featured drawings to accompany descriptions of various medical conditions and treatments. This is the marble relief with a parturition scene, and in it we see a woman lying on a bed, giving birth to 2 or perhaps 3 children. She is assisted by 3 women. It is noteworthy that the woman giving birth is lying down. It's been said that in antiquity, women gave birth only in a seated position. In fact, there's a relief that shows this in the facade of Tomb 100 of the Isola Sacra necropolis. However, in the early 2nd century AD, Soranus of Ephesus mentions the general rule that extraction of the fetus in difficult labor must take place with the woman lying down. During the Middle Ages, illuminated manuscripts in Europe included medical illustrations, although the accuracy of these depictions varied. 14th and 15th century texts included elaborate illustrations and were oftentimes pocket-sized for the convenience of the healer or medical practitioner. The Renaissance marked a significant period for medical illustration, with artists like Leonardo da Vinci creating detailed anatomical drawings based on dissections. Andreas Vesalius, a 16th century Flemish anatomist, further revolutionized medical illustration with his groundbreaking work De Humani Corporis Fabrica, which featured accurate and detailed anatomical drawings. In the 19th century, the advent of printing technology allowed medical illustrations to reach a broader audience. Medical textbooks and journals began incorporating more detailed and standardized illustrations to aid in medical education. Illustrations played a crucial role in conveying complex anatomical structures and pathological conditions. With the development of photography in the 19th century, medical illustration faced competition, but artists continued to contribute by combining artistic skill with scientific accuracy. In the 20th century, advancements in printing technology and medical imaging further transformed the field of medical illustration, allowing for more sophisticated and detailed visuals. Today, medical illustration encompasses a wide range of media, including digital illustrations, comics, graphic pathology, and 3D modeling. It remains an integral part of medical education, communication, and research, helping to convey complex medical concepts and procedures with clarity and precision. Comics in medicine also have a long history, beginning in the 1800s. They were mirroring what was happening in medicine, and it actually gives us today insight into the history of medicine at the time. Rudolf Toffler really revolutionized the idea of the comic strip during this time, and is still considered to be the father of the modern-day comic strip. And these comics were specifically developed for mass audiences. As such, more artists were looking into medicine. This is an example from Puck magazine called Death's Head Doctors: Many Paths to the Grave from 1881. Coinciding with a revolution in print technology and the rise of widely disseminated illustrated magazines and newspapers, comics of the era richly illustrate the skepticism, contestation, and achievements of the therapeutic revolution. They also provide a critical history of this era of medicine, drawn from outside the field and expressive of broader social and cultural concerns, ones that maintain contemporary resonance. One notable historical comic that communicated health information is The Yellow Kid by Richard F. Oko. While not explicitly a health-focused comic, it played a role in health communication. This comic strip, which started in the late 19th century, featured a character called the Yellow Kid and was published in Joseph Pulitzer's New York World. The Yellow Kid's image was later used in public health campaigns to promote good hygiene and influenced behavior in a period where understanding the importance of cleanliness was gaining momentum. During the Second World War, the US government produced a comic titled Your Health Comes First. It was a part of the Your Life series of educational comics distributed to the armed forces, emphasizing personal hygiene and health practices. These examples, while not exclusively health-focused, demonstrate how comics were utilized to convey health-related information and promote public health messages during different periods in history. Other examples began to pop up just after the conclusion of the Second World War. The Dr. Wonder series, which was a comic introduced in 1947, educated children specifically about health topics. There was also E.C.'s Psychoanalysis in 1955 and Archie's Adventures of Young Dr. Masters in 1964, both very early examples of graphic medicine that were not at the time known as graphic medicine. As we have seen, the concept of using illustrations and comics to communicate health-related information dates back centuries. However, the term graphic medicine was coined by Dr. Ian Williams, a colleague of mine and a British physician and artist, in 2007. He founded the website graphicmedicine.org to explore this intersection of comics and healthcare on a global scale. The genre gained traction in the early 2000s with publications of works like Our Cancer Year by Harvey Pekar and Joyce Brabner, and Mom's Cancer by Brian Fies. These were both personal stories dealing with illness and healthcare. Marbles, Mania, Depression, Michelangelo and Me by Ellen Fournier, and Stitches by David Small further illustrate the potential for graphic narratives in addressing mental health and trauma. Since then, graphic medicine has expanded with numerous academic conferences, publications, and the inclusion of comics in medical education. It has become an established field, fostering empathy, understanding, and awareness of medical and health-related topics through visual storytelling. Its use extends to patient education, medical training, and public health communication. Mom's Cancer by Brian Fies started off as a webcomic and goes through what happened when Faiz's mother was diagnosed with metastatic lung cancer. The final book is less about the science and the medicine, and more about the experience of living with cancer, in addition to family who is living with a cancer patient. Faiz openly talks about the fear, guilt, pain, and struggles both him and his mother go through throughout the novel. Stitches by David Small is based on his own life. His dad is a radiologist, and he was a sickly kid. Unknowingly, his dad, as a radiologist, had exposed him to nearly daily doses of radiation, which in turn ended up forming a mass on his neck. He goes through a horrible surgery to have it removed, and it basically renders him mute. Now, this book is an examination of all of those stages, but again, more so the feelings involved with the cancer diagnosis, the blame on his father, and the chaos it caused amongst his entire family. So what is the impact of graphic medicine? Well, visual narratives in medicine can have a profound impact on a variety of aspects. Graphic medicine can enhance communication. Visual storytelling makes complex medical information more accessible and easier to understand for a broad audience, including patients, caregivers, and healthcare professionals. It can also foster empathy and understanding. Comics and visual narratives often evoke emotional responses, which foster empathy and understanding of medical conditions and the experiences of those living with illness or undergoing treatment. It can also be used in patient education. Using visual aids in patient education enables better comprehension of health conditions, treatments, and lifestyle changes. This can lead to improved adherence to treatment plans and healthier choices. It's also used in medical training. Comics are increasingly used in medical education to help students understand patient perspectives, ethics, and complex medical scenarios. They also encourage reflection and discussion. Graphic medicine has also contributed to reducing stigma. Visual narratives can humanize and destigmatize certain health issues, mental health challenges, disabilities, and chronic illnesses, and foster open conversations and reducing social stigma. It also provides a platform for engagement and retention. Visual storytelling captures attention and aids in information retention, making it a powerful tool for public health campaigns and awareness initiatives. The impact of graphic medicine and of visual narratives in medicine is multifaceted, contributing to better communication, understanding, education, and empathy within the healthcare field and society as a whole. Another incredible example would be Monsters by Ken Dahl. This book chronicles the author's journey of being diagnosed with the herpes virus and the stigma associated with it, as well as the medical problems and how to form a relationship when there is so much stigma. To get more specific, graphic medicine offers several benefits to patients. Enhanced understanding is an important part of graphic medicine. Visual narratives make medical information more comprehensible, which can help patients better understand their condition, the treatments available, and potential procedures. This work is called Stop Ebola by Crispin Evans and was a public health campaign to educate the public on the highly dangerous Ebola virus, to dispel rumors and stop discrimination about a disease that isn't understood. And this was done in the form of a comic picture book. A really important aspect of graphic medicine is the emotional connection. In fact, comics and graphic novels tend to evoke emotional responses, which can enable patients to relate to characters and stories and really foster a sense of connection and empathy. There is something to be said about finding a sense of belonging within comics that is unique. Validation is a really important aspect of graphic medicine. It shows us that we're not alone and that we don't have to suffer alone. This is a panel from the work Kid Gloves by Nisley, and it's the story of Nisley's struggle to get and stay pregnant following 2 devastating miscarriages and her harrowing delivery. She suffered a seizure, along with dangerous blood loss, and was unconscious when her son was born. And even after all that, she ended up spending a week in the ICU. Miscarriage, pregnancy, a lot of women have experienced this, and it's a candid story about these issues in a delicate but well-informed way. Graphic medicine can also help us make informed decisions. It assists in these informed decision-making processes by presenting various healthcare options or scenarios in a more engaging and relatable manner. Critically acclaimed comics like the one below, Blue Pills, A Love Story by Frederick Peters, and of course, Monsters by Ken Dahl, individually tell stories about the health, emotional, and social aspects of communicable diseases, with mixed results in terms of the impact on patients in making informed decisions based on graphics. This is significant nonetheless. The communication between patient and healthcare provider is incredibly important, and graphic medicine can facilitate these discussions between patients and healthcare providers, and can also help patients articulate their experiences and concerns more effectively. As we saw in Brian Fies' mom's cancer, Fies was his mom's carer as she went through aggressive lung cancer. So it's as much of a breakdown of her symptoms that her doctors could see in real time as it is explaining the difficulties he was facing as her carer. Graphic medicine also teaches us about coping and mental health. Visual narratives can aid in coping with illness, trauma, and mental health challenges by offering perspectives, insights, and relatable experiences. Depression comics by Clay Jonathan are an ongoing webcomic and talks about Jonathan's lived experiences, about finding validation in the experience of depression, and just exploring a lot of emotions that many of us have experienced before. Graphic medicine also looks at things like coping as carer and the relationship dynamics between carer and patient. Our Cancer Year, for instance, looks at Harvey Picar's battle against lymphoma. Joyce Brabner, his wife, and him were in the middle of buying a new house when he was diagnosed, and it chronicles this journey through the couple trying to navigate their relationship in addition to the cancer treatment and suffering Picard experiences. In addition to a wide variety of patient benefits, graphic medicine provides several benefits to healthcare professionals specifically. Graphic medicine can also be a platform for improved patient communication. As we've seen, visual narratives aid in explaining complex medical concepts and treatment procedures to patients, facilitating clearer communication and better understanding. Graphic medicine is being implemented into medical education and medical schools because it has been shown to improve bedside manner. Doctors are humans too. Taking Turns by M.K. Serviak, who is a nurse by trade and goes by Comic Nurse, uses comics to communicate with her patients regarding news, ideas around consent, and trying to parse through the variety of feelings associated with being ill. These types of comics also foster better empathy and understanding. It can help healthcare professionals gain insights into patient experiences and foster a deeper understanding of the patient's perspective. Graphic medicine is also being implemented in medical education, providing a more engaging and memorable way to teach students about patient experience, ethics, and various medical scenarios. It also asks them to reflect on their own experiences. A new comic created with shame in medicine will be used to teach medical students about the role of shame in their training to become doctors. Needlestick tells an experience of a US-based dermatology resident, Olivia Davies, while she was in medical school. Like I said in the previous slide, graphic medicine can also contribute to healthcare professionals' professional development. It can aid in reflective practice, allowing healthcare professionals to explore and understand diverse patient experiences, ultimately enhancing their skills and approaches in patient care. Doc Related by Dr. Peter Valenzuela highlights the real day-to-day challenges of value-based care and HCC coding from a physician's standpoint, and in ways that are short, memorable, and entertaining. In addition to regular communication, graphic medicine can actually enhance communication skills. It encourages healthcare professionals to explore alternative communication methods and storytelling techniques, which can be beneficial in conveying information and building rapport with patients. The Bad Doctor by Dr. Ian Williams is about a medical doctor who is also struggling with obsessive compulsive disorder and is trying to better treat his patients. He's constantly second-guessing his decisions and is constantly at war with himself. This book shows a side of medicine we don't often see because of white coat syndrome. Doctors are just as human as the rest of us, just as fallible, and just as scared of failing. Obviously, graphic medicine has changed communication for doctors and patients, but it's also impacted the comics and graphic novel landscape in many ways. It's provided diverse content. It's expanded the content of comics beyond traditional genres, incorporating health-related stories and personal narratives, and fostering a more diverse and inclusive comic book landscape. This piece is from the Navajo and Hopi families' COVID-19 Relief Fund and is written in Diné Bizaad, going through the symptoms and precautions with COVID-19. Graphic medicine has also provided new perspectives and increased awareness. It's raised awareness of the potential for comics to communicate complex medical and health-related information, which has attracted new audiences interested in health-related narratives. It has also brought in new creators, writers, artists, and healthcare professionals who contribute their unique perspective to this medium, enriching the storytelling and artistic styles within comics. Omni by Aletha E. Martinez, who worked as an inker on Black Panther, created this superhero comic mixed with aspects of graphic medicine. Her main character is a medical doctor whose superpower is lightning-fast thinking. Graphic medicine has also been instrumental in blurring boundaries between disciplines. It's blurred the boundaries between art, literature, and healthcare, demonstrating the versatility and power of comics in addressing serious and sensitive topics. What is interdisciplinarity? Why is it important? many disciplines in their very nature are already interdisciplinary. But if we, as researchers, can speak across multiple disciplines, it will provide a more holistic approach to a topic. A case in point, this is a patient education comic for a Le Bonheur Diabetes Clinic. The topics were aimed at different ages and included nutrition, driving, and identity. Below is the first page of Poppy the Loudest Puppy, a comic book designed to make young children comfortable with asking for help if they don't feel well because of an increase or a drop in blood sugar. Using fun and relatable art to talk to young children, graphic medicine can tackle real-life medical issues in its pages. Graphic medicine has also had significant social impact. These health-focused narratives within comics have influenced public perceptions, contributing to a greater understanding of health conditions and experiences. This is a work from Drawing a Diagnosis by an anonymous young female doctor who draws her cases as blog posts daily. This one is an unusually severe case of varicose veins. These were superficial, close to the surface. However, they were inflamed, phlebitis, and they can cause considerable pain. And this, of course, is also a risk factor for developing a DVT. These works are informative, simple, beautiful, and still keep private information confidential. Graphic medicine also contributes significantly to stigma reduction, and we know that there is still significant stigma around certain health conditions and certain bodies in medicine. We know that graphic medicine has made an impact in comics because people that read comics go to them for a sense of belonging they don't find anywhere else. Finding comics that align with the discrimination they may be facing not only helps with being informed around certain aspects of disease or disorder or their experience, but also provides significant validation. Shrink, Story of a Fat Girl, explores the impacts of being too fat in a society that has dictated the medical and social dangers of being so. As with any good practice, there are ethical considerations in graphic medicine that revolve around several key aspects. The first is representation. Ensuring an accurate and respectful representation of individuals, communities, and medical conditions is crucial in graphic medicine to avoid perpetuating stereotypes or causing harm. 2 is informed consent. Obtaining informed consent from individuals whose stories are depicted is essential, especially when sharing personal health narratives. Respecting privacy and ensuring individuals understand the potential reach of their story is also crucial. 3rd is balancing realism and sensitivity. Striking this balance in depicting medical conditions and experiences is important. Graphic medicine must convey the truth of the experiences without causing unnecessary distress to the audience. 4 is clinical accuracy. Maintaining this accuracy and presenting medical information factually is crucial to avoid misinformation or misunderstandings about health conditions, treatments, or medical procedures. 5 is audience consideration. Considering the audience's age, their cultural background, and emotional readiness to engage with certain health topics is necessary to ensure appropriate and sensitive content delivery. 6 is avoiding exploitation. Preventing the exploitation of personal health narratives or sensitive medical information for commercial or sensational purposes is also vital in maintaining the integrity of graphic medicine. And lastly, acknowledging researchers, artists, and graphic medicine researchers are people who feel. In medicine, there is an expectation to be objective, but denying humanity is never fully possible. By addressing these ethical considerations, creators and practitioners in graphic medicine can ensure responsible, respectful, and informative storytelling that contributes positively to healthcare discourse and public understanding of health-related topics. I want to do a little thought experiment. I want you to have a look at the panel I've provided from a graphic novel called Marbles, Mania, Depression, Michelangelo and Me by Ellen Fournier, which highlights the author's diagnosis of bipolar disorder. I'd like you to pause the video here for 2 minutes to think about and write down the ethical considerations I mentioned in the previous slide and apply it to this panel. How might this actually be harmful to a patient? Have you taken your 2 minutes? What might make it controversial is that it doesn't always show the whole picture, and the things that Fournier talks about are becoming dated. The DSM-5, the Diagnostic and Statistical Manual of Mental Illnesses, has changed its categories to reflect axes rather than a mental illness categorized as one particular thing. There's a lot of overlap. This information is constantly being updated. So what happens to the graphic memoir that has old information? Is it important to reflect and reprint? This panel in particular may also actually discourage someone from seeking medical advice or medication. There is nothing to be ashamed of, by the way. It's important to know potential side effects of medicine, particularly psychiatric medicine, but the way in which she interacts with the doctor and what is said could prove to be problematic to the reader. As I mentioned in my introduction, I've been working on how the fat body exists in medical and social spaces. So I'll now take some time to present my research in graphic medicine. Now, I've chosen to refer to fat individuals as fat rather than obese in this presentation for a reason. Firstly, there are medical associations with the word obese that are inherently diagnostic and objective, and similarly associated with flagrant fear-mongering. While the word obese is supposedly considered more polite, fat is a loaded word that has been historically associated with something disrespectful. There is, however, this notion in fat activism as a sort of coming out as fat, where an individual seek to recapture the actual word and negative connotations of fat to turn it into something positive and affirming. One of the arguments surrounding the changing of the meaning of the word fat is that while the fat body itself cannot be dismantled in its fleshiness, and neither can the politics or discursive resistance, in changing the meaning of the word, the possibility for changing the experience for people living in a fat body would change in a positive way. Hence, the use of the word fat for the purposes of this talk will not be used as a negative term, but rather a descriptive one. Shrink, Story of a Fat Girl, is a graphic novel that examines the fat body in contemporary Canadian culture. It is the experiential journey of the book's unlikely hero as she chooses to lose weight in a world that has dictated the medical and social dangers of being too fat. Shrink takes the reader through the social complications of fatness, the medical gaze upon the female body, monstrous bodies, diet culture, fat shame, and the body positivity movement. It examines the critical notion that weight loss is the only path for a fat person, in addition to ideas about achieving the perfect body, obsessions about healthism, pushback from feminists and activists, and why, ultimately, it is so important for a person to demand autonomy over their own body. Shrink is about choices: to lose weight or not in a society of contradictions. As a researcher, I employ research creation, that is, using artistic processes to discuss and operationalize knowledge and data. This means of dissemination is very dear to my heart. It has allowed me to access and participate within the upper echelons of academia, but most importantly, has allowed engagement from the very populations I seek to represent. Good art has the ability to access our emotional experience. Good art and good research combined helps us think critically about our own social environments inside and outside of academia. I think it's important to recognize that there are different ways of knowing, of learning, both within academia and amongst other populations. For my research to have credence, I realized that while the data was incredibly important, the method of delivery would have a great impact depending on who my audience was and how they learn and adapt to knowledge. Working in an interdisciplinary mode of research with medical sociology, medical history, and fine arts all together means that I have a privileged chance to work with women in the community. And this meant finding ways to better share research with them that may fall outside of traditional methods. In thinking about how I would disseminate up-to-date research on fatness, I decided upon graphic medicine that further draws on the graphic novel as academic artifact. It is both an approach and a doctrine regarding the importance of images when discussing difficult topics. The fat body is an othered body, both by medicine and by social standards. I wanted to explore just how this was done, because I myself have been through these experiences from both ends of the spectrum. Seeing the world from the perspective of a medically obese woman making a change to be relinquished of that description and gradually regaining some of the weight, which is really an inevitability given social determinants of health, genetics, COVID, and life in general. The images are never simply just images. Each is saturated with stylistic considerations, gestures, and various culturally specific elements as a way of expressing a particular idea. Ergo, it would be impossible for shrink to function outside of Canadian culture, or Western culture at least, as in order for the fundamental meaning to be understood, it follows a particular symbolic order. Fatness and discussions around fatness will most certainly differ from culture to culture, and time period to time period for that matter, making stylistic and linguistic choices imperative for meaning generation. This work is an observation between fatness as a sign and what it signifies based solely on the experience of having this connection habitually made. For instance, fat bodies are equated with the consuming of food or appetite, but are not to be consumed as a piece of functioning social capital. Further, these bodies are associated with laziness, non-fitness, non-functioning, abnormal behaviors, the list goes on. The observations in this work are not arbitrary. These are consistently sanctioned signs and significations related to how fat bodies function in our culture. Metaphors in this work were of importance for this reason. Fat bodies do not have the luxury of being privileged to consumptive gazes. Rather, they are more prone to stigmatizing stares. However, shrink encourages a taking back of bodily autonomy from a body that is stared upon to a body that stares. Without further ado, I'll dive into some examples of the data that I was working with that has been disseminated through shrink and why it was done in this particular way. It is important to note that while it is not medicine specifically that originally created the obesity epidemic, it would still become a topic of significant health concern for national and international public health agencies, health researchers, and the popular press. The notion of obesity as an epidemic began to form in 1990 when weight loss medications were beginning to be prescribed by drug companies, when there was little to no evidence that demonstrated that weight was a health concern on its own. At the time, it was considered more cosmetic. Further, in 1995, the World Health Organization published a report on the BMI scale, noting that while there were 3 grades of overweight, not obesity, the cutoff methods were inconsistent. Obesity as a concept did exist at this time, but the scientific consensus as to what that meant for an individual's health was lacking. The international disease mongering and fabricated panic around the supposed health risks of the obesity epidemic, as it's known today, came from the International Obesity Task Force in 1996, which was funded by drug companies. The purpose of this task force was to lobby the WHO into concluding that obesity was indeed connected to ill health, and pharmaceutical interventions, such as the heart valve damaging fen-phen and Redux, among others, were needed to correct an ever-growing problem. Following this, the WHO, who were reluctant to the changes being proposed, published a report that was heavily edited by the IOTF, which stated that the new cutoff for normal BMI was 25 from 27, and that 25 to 30 was now pre-obese. With successful lobbying, a significant proportion of the population had become either overweight or pre-obese overnight, allowing for the IOTF to continue to fearmonger the health effects of obesity across a much broader audience. The WHO helped to continue this health panic, and it became widespread across media, national, and provincial governments. Medicine as an institution, while not necessarily directly involved in the creation of the panic, has since followed suit and published problematic studies on obesity funded by the private sector. Other more critical perspectives on fatness, however, are less alarmist than the mainstream sources and suggest that obesity is not the problem it's been made out to be. These alternative perspectives come from a group of international fat studies and critical fat scholars working in a number of disciplines, including sociology, kinesiology, nursing, public health, and medicine. These scholars argue that obesity and the obesity epidemic are discursive categories, or systems of thought that interact with and reinforce norms of gender, race, class, and sexuality, helping to maintain inequitable power relations and social structures. They argue that the health effects of obesity have been overstated, while the statistics underlying the obesity epidemic have been inflated by the collapse of rates of overweight with rates of obesity in almost all government documents and media reports. Additionally, some scholars suggest that obesity rates have actually leveled and in fact declined for specific populations in some countries, including Canada. Such a critique is increasingly supported by medical and population health research, which suggests that overweight and obese people, by BMI standards, are not necessarily unhealthy. The alarmist nature of the medical discipline uses what theorist Michel Foucault describes as the medical gaze to fix unruly bodies, like the fat body. In essence, the medical gaze is the objective viewpoint used to break down bodies into parts and symptoms to be analyzed, and erasing the patient as an actual person. Objectivity is considered to be generally useful in medicine in that a doctor is able to distance themselves from a patient. But what is lost by simply looking for the allotted 15 minutes is everything else that makes up a person's life. There are significant problems for fat individuals in receiving adequate care because of this detached practice. Patients are not being believed, illness or injury is being boiled down to a weight issue, and biases are rampant in the Canadian medical industry. Not to mention this idea of the medical gaze disciplining bodies into normalcy. A doctor constantly telling a patient to lose weight, regardless of the reason for the visit, is the most common. This is discussed a few times through Shrink, both explicitly and subtly, particularly in mentioning tools to discipline behavior. When a body is rendered deviant in some way through medicine, an intervention to discipline this body into normalcy is implemented. Feminist theorist Elizabeth Grosz furthers this notion in her discussion of body literacies. The idea that the construction and reconstruction of knowledges around bodies means that there will always be those who fall short of normalcy. Medical intervention is both about the medical gaze upon the body as much as a body's gaze against itself. Michel Foucault's panopticon theory in Discipline and Punish demonstrates this clearly. As social beings, we are subject to surveillance from others as much as we are expected to survey others and ourselves. This practice of gazing is a means of a consistent relationship with state power in the sense that it keeps a docile, obedient, and normalized mass. We also have social gazes at play in the fat discourse. The ideas of social capital and the stare, discussed at length by Rosemary Garland Thompson, who is a disability scholar, are conditioned upon the successful presentation of normative standards. Establishing bodies as social capital in a capitalist system, that is, the process of normalizing expectations with regard to how bodies look and work, also manufactures said bodies as consumable objects. The male gaze is a good example of this and is a privileged one. Canadian culture allows men to have the luxury of looking at women as bodies to be consumed. There is a figurative and literal hunger to be satisfied here, as this particular gaze is perpetuated through clothing advertisements as much as it is through stripteases and erotic massage. This gazing and the act of being gazed upon is a privileged position afforded to bodies who fit within the confines of the normative consumable. And we've already established that the fat body isn't normal via medicine, and thus it follows socially as well. As such, The fat body doesn't fit into this normative standard and is therefore othered. It is then subject to means of othering. Garland Thompson explains that there is a sense of domination inherent in staring at other bodies. But Shrink takes this a step further by noting the physicality as much as linguistic means of othering fatness. Being hit in the streets, being called a fat lard, being laughed out of the gym, there seem to be multiple societally sanctioned ways of convincing a body that it is not normal or welcome. Mobility, in that sense, is limited for othered bodies, not just fat bodies, and not always in the physical sense, but through a constant reiteration of a specific body ideal. This is realized in the smallest of ways, such as what clothing size a store will go up to. And I always found that really funny. As a fat body, I was expected to change, yet we still laugh at any fat person going to the gym, and we don't provide comfortable or adequate workout clothing. There are many other examples, and it really is a conundrum. Now, I've only touched on a few very basic ideas that Shrink looks at, but by no means is that exhaustive. Shrink will be published in fall of 2024 by Penn State Press and will be available across a variety of bookstores and libraries and hopefully doctors' offices. So if you see a copy at some point in the next few years, please have a read because there are so many things I haven't covered. Shrink uses both image and text to represent, trouble, construct, and deconstruct notions of fatness in Canadian culture. Each visual decision was carefully chosen to provide the reader with the richest and most poignant experience of this information. It's sometimes snarky and sometimes satirical, but gives pertinent information on the fatness debate as much as validation for the experience of living in a fat body, or really any body, given how likely each of us has experienced a facet of the issues I've mentioned at some point and in some way. Sharing both sides of the fatness problem was particularly important, as oftentimes the liminal space that this work occupies is not discussed. By constructing the images and text in such a way, complex theories can be disseminated across a variety of knowledge bases. I've come to realize that working within research creation for a long time and adopting graphic medicine has now given me the opportunity to be creative in how I choose to disseminate research. For me, it's representative of an ability to look and encourage looking at a problem in a different and perhaps novel way. Now, our first module is coming to a close. I realize that it was a lot of information all at once, but I hope it's getting you to think about how we can use comics in healthcare. For our first exercise and the first page of our workbook, I'd like you to start by thinking of an experience you've had as either a patient or a healthcare professional. Just one for now. One specific experience you've encountered. Maybe it's a difficult patient. Maybe it's experiencing a symptom of a disease or illness for the first time. If you were explaining that experience to someone, what would you want them to take away from it? Is it a point of information? Is it validation for others? Or is it both? Jot down a few lines that talk about the experience and how, if you created a comic around it, it could benefit others. I will see you all in Module 2.